Can you run through your knee pain? The answer depends on many factors. Hi, I'm physical therapist Dr. Trent Corey, and today I just want to talk about, the thing that I hear a lot about from runners is that they're trying to run through their knee pain, like meaning they have some nagging thing going on their knee, but they still go out and run. And, I think as a runner, most runners have had some sort of injury happening and they'll go run. And they'll just keep running through it as long as it kind of, quote, loosens up, right? So, there's many thoughts of like what we should be doing when that happens. Typically, when you have an issue and as you exercise and move, it starts feeling better. That's a good sign that your body really likes it. And, we need that movement to help the knee joint stay healthy. So actually movement can be a healing thing. However, running, and especially running the wrong way, with bad form, that hitting the ground really hard, those kind of things, if the problem becomes worse with rest afterwards, like when you start running, you start loosening things up and then the pain kind of decreases because you're getting movement to happen. The lymphatic system gets whatever inflammation might be going on in there to go away, but also you get an analgesic effect, meaning like the painkillers come in, the endorphins from feeling happy, the runner's high, helps you get rid of the pain because your brain's feeling those happy chemicals, and so you don't feel the pain as much. Which it's really helpful in a survival method, right? Where our bodies are, in tune to kind of when we have emergency situations and we're like, you've heard stories of people breaking their ankles or whatever, and they go run to safety or they save somebody and get out of danger. Well, part of that mechanism is in this, when we have an injury, that we have the survival mentality to go in, to help us get to safety. So for running, that's kind of what's going on a little bit sometimes. And so we have to be aware of that and making sure that as we progress and as we're doing our stretches or if we're doing exercises to help balance out our body, that we're doing those things to balance and make sure that we're working correctly to get things back on track. And that we're not also increasing our amount of running that gets to the point where, you might be doing more damage than good. So there is a balance there. We have to make sure we're watching that we're doing the right amount. It's like the Goldilocks situation. You want to have it just right. You don't want to go too much, too hot, too cold. We want to find that right amount. Sometimes it's a moving target, but that's just kind of part of the way it is. And so if we can kind of make sure that those things aren't irritating as we're running, then we can run. But if you get out on the road and like instantly as you run more and more, it's getting worse and worse, it's a sign for your body to stop. And that's when you need to be going to see a physical therapist or working on through our Outrun Knee Pain program, where you balance out the body through specific exercises and modalities that we kind of make sure that you're dialed in to the exact things that you need to do to balance out. And then going through an assessment to make sure that you are ready to run. And, I run the run fit assessment, which basically goes through a series of things to make sure, hey, we've checked all the boxes, that we're really making sure that we're healthy and ready to go. We're balanced out. We're not going to cause major compensation things to happen that causes a whole other issue. Because it happens, you have one thing and then it goes to the other leg or goes up into your hip or your back or some other ankle issue because you're pushing off that side more. All these things matter, and we got to make sure that we take care of it. So going through a program that's regimented, it has a balance, and making sure the whole body is in symmetry and that you're working on all the facets of making sure your body is ready to do the activity healthily. Not to just go through and just survive and, you're hurting routinely. You kind of just go through this nag for months and months. And I've had patients for years. I've had issues sometimes where I had an issue where it just continues to fester and never gets better because you never adjust the core causes of the issues. So make sure you do that. I don't want people to have to do that. There's no reason to. It's just a matter of motivation to see the outcome of how you really want it to be as a runner. Versus just kind of getting by and just getting past your pain. So hopefully this helps. I hope this is at least some good advice that you can kind of take to heart and, still find the ways to get out and run and make the running a therapeutic thing in your body. Watching at ways that you can balance at your body too. I'm always happy to help. I'm Dr. Trent Corey, physical therapist. You can find me at findyourselfrunning.com, and outrunkneepain.com is my webinar page that goes through a series of three steps that you can do to outrun your knee pain. So, wish you the best. Take care, and happy running.